University of Alabama at Birmingham. And I'm here today to talk about a recently presented randomized controlled trial that randomized 733 rheumatoid arthritis patients that had failed at least one DMARD or biologic to management with either the RAPID-3 disease activity measurement tool or the CDAI disease activity measurement tool. We had two goals of the study. The first goal was to understand whether at 12 weeks the RAPID-3 is as good as the CDAI to manage RA patients. So this is quite a novel trial design because it is a randomized controlled trial, but it's not randomizing people to a drug or even necessarily a treatment strategy specifically, but really to a measurement tool. And of course the relevance of that measurement tool is that unlike many of the treat to target studies that are coming out of Europe, in the US, as you well know, the DAS requires a lab test with some fancy math. And so most people don't find that a practical measure. I know I certainly don't at UAB. And so for that reason, a number of alternative measures have been promulgated as perhaps being as good or close to as good as the DAS that don't have those two requirements, that you have a SED rate or a CRP in real time, and that you don't have to enter anything into a calculator that then does an equation. So the purpose of the study is really to understand whether the RAPID-3, which includes only patient-reported outcome measures, pain, physical function, and then the global score, everything that can come just from patients, there's no doctor data involved in collecting the RAPID-3, could be as good as, or perhaps better than the Clinical Disease Activity Index, or the CDAI, which includes a formal 28 joint count, tender joints, swollen joints, and then the physician's assessment of disease activity.